horses are frequently moved for competitions, breeding purposes, and veterinary care. While proper restraint during travel is crucial to prevent physical injuries, prolonged confinement, particularly of the head and neck, can unfortunately lead to problems in their lower airways. Think about it. When a horse's head is held in an elevated position for an extended period, the natural mechanisms that clear mucus and bacteria from their airways can be disrupted. Research has shown that even relatively short journeys of a couple of hours can sometimes result in an increase in inflammatory cells within the airways. Longer trips can have more significant consequences, contributing to the development of respiratory illnesses like pneumonia, which can be life-threatening and potentially end a horse's athletic career. Transportation stress can also trigger a cascade of physiological changes, including increased stress hormone levels and alterations in immune function, further raising the risk of respiratory problems. Detecting the presence of respiratory pathogens in horses after long-haul transport highlights the potential for infection during these times. Recognizing these risks, researchers have been actively seeking effective strategies to maintain the respiratory health and overall well-being of horses during transportation. One idea that has been explored is lowering the horse's head below the level of their withers during transport to potentially reduce airway inflammation. However, other interventions, such as the use of certain antibiotics, have not proven effective in preventing airway inflammation in confined horses. The need for a reliable method to combat mucus accumulation and inflammation during transportation is therefore paramount. This brings us to the focus of the study we're discussing today, the potential of a compound called N-Acetylcysteine. It has a history of use in human medicine for over 4 decades in treating respiratory conditions like chronic bronchitis. Beyond its mucolytic properties, NAC is also known for its antioxidant effects. Furthermore, it has demonstrated anti-inflammatory properties by potentially inhibiting the activity of pro-inflammatory molecules. While the benefits of NAC have been studied in humans, its effectiveness in horses requires specific investigation. The findings suggest that administering NAC orally before transportation could be a practical strategy to substantially decrease mucus accumulation and inflammation in the lower airways of horses during long journeys.